Hi, my name is Danielle Milton. This is PA-ACMVET 403, Perform Clinical Pathology Procedures. My student ID is 14196362. This is me just setting up for task 1. I'm going to be placing an IV and collecting blood from the catheter in order to fill tubes. So at my workplace we have designated autoclaved IV trays that get made up with cotton balls, and they go through the autoclave, and then we make them up further with, like you saw, a prime T port, a bio-occlusive dressing, an assorted kind of range of catheter sizes. So we try to include the 3, and then also a non-winged version as well as a winged version, just based on staff preferences. We also, as standard, include a flush, just to obviously ensure the catheter's in. My patient is a Great Dane, so I'm going to add in a green and grey catheter as well. I'm also going to grab a tourniquet just in case, and further brown tape to secure the IV. To bandage the arm, I'm going to be using SoftBand and VetWrap, and then a further smaller piece of brown tape just to secure the T-port in place. From this patient, we will be getting a biochemistry test and a hematology test, so an EDTA tube and a LithHep tube. We're going to be running them in-house, so a UFO for an IDEX compatible blood machine is okay. We also set up for a PCV-TP, so wax plate and heparinized tubes, as well as a specific blood gas syringe too, because we'll be getting a blood gas, like a venous blood gas sample on this patient as he's presenting to an emergency. Once my tray has been set up to be appropriate for the patient I'm going to be using, I can then use our prepared alcohol scrub solutions to fill up the cotton balls, the autoclave cotton balls that are already in the tray. My clinic uses a dilute Chlorhex and then an alcohol preparation as well. Here I am just placing an IV into the left cephalic of this Great Dane. We do try and grab a blood sample once we have that first initial bit of tape in, before we flush any site, just to make sure that we're not diluting any of the blood and then diluting our sample. So once I've aseptically prepped the leg and given the alcohol solution enough time to dry, I'll go in at a 45-degree angle, wait until I have flashback, and then advance the catheter. From here, taping in is our priority, just to make sure it doesn't go anywhere after we've secured it, or before we can secure it, sorry. So from here I will start with a plain 3ml syringe. Not pictured is me passing the 3ml syringe off to an assistant for an immediate blood gas sample. So we gain 3 mils that we can, and then use 0.3 of a mil as first up, inserted into a radiometer syringe for our blood gas machine. That syringe does contain LithHep. Here I am, just securing a T-port, trying to rectify the little bloodbath that's happening here. Once our blood gas tube has been filled, then we can fill up our EDTA Vacutainer and LithHep tube. I have to apologise, in this video it appears that I fill the EDTA tube first before the LithHep, and this is not the correct order of blood draw. Usually EDTA is one of the last ones we fill up, but this syringe had already been inserted into the LithHep container, I guess, in the form of a blood gas syringe. So we can use the EDTA sample was just used as a demonstration for the procedure. We wouldn't be able to use it for accurate results. We make sure that we don't tape over the insertion site, so we use a bio-occlusive dressing. In this hospital it's Tegaderm, just to cover we use the brown tape on the catheter hub itself, and then the bio-occlusive to protect the dressing from, protect the wound site, from infection, but also so that we can visualize it at our 4-hourly checks as well. It just allows us to not have to retape every time we perform IV maintenance. So I just fold over the end of my SoftBand to create a little bit of a comfort square, to stop the IV and the teapot from rubbing onto the patient's skin. I then go up all the way with the soft band to cover all of the Tegaderm, just so that none of the IV site is visible. Then I secure that with vet wrap, making sure that the print itself is not stretched on the vet wrap, meaning that the bandage is too tight, and then a small piece of elastoplast. If the blood samples collected were going to a lab, they would be put into vacuum tubes, and they would be labelled with a patient label, stored in the fridge in a plastic sample bag, and then all sent to the necessary laboratory in the morning, whether that be the one that we have on campus, or QML, or sent off to IDEXX. This is task 1.2. I'm just showing my ID badge. So there's the blood sample that we collected for in-house use. Here are the patient labels that I would attach if it was going external. And of course I would cover just the label on them. If I was sending off a Lith Hep tube, same deal, but in a green container. I'm not able to send out the UFOs. They're compatible with the IDEXX machines only. We would get a pathology request form signed by the veterinarian, and that would be included in the Ziploc sample bag that's labelled as a biohazard. This bag itself would then be stored in the fridge. In order to create a blood smear from this EDTA sample, I'm going to lay out 3 microscope slides. I use one as a spreader and try and get 2 samples if I can, just in case one does not turn out as great as the other. So I use the capillary action of the heparinized tubes just to get a little drop of blood. Ideally we don't need too much on there. We are aiming for just that single layer of cells. I then use my spreader slide at a 45-degree angle. Just soften it up a little bit on the bench, and then push forward once the blood flows to the end of the slide. Push forward just to create that feathered edge on top. I try to air dry it as much as can when I've found one that is appropriate for use. So I'll wave that in the air a little bit, make sure I label it with a permanent marker just with the patient name, and in this hospital the department that is overseeing the patient, so ECC or GP, or med or surge. So we've labelled our patient slide. From here we can stain it. We can start with the fixative. These solutions are not great for your skin, but they don't pose a real serious threat. I'm only using PPE just because I'm a little bit clumsy and don't want the tissue to stain my skin if I was to spill it anywhere. So I start by fixing the sample to the slide in a fixative solution. I dunk for 7 to 10 times just to make sure that the sample is definitely fixed to the slide. It's on there, it's not going to go anywhere when we further stain it. So I rock it back and forth on a pee pad just to get any excess off, and then I continue with our first stain for, again, between 7 and 10 times just to make sure that the whole sample is sufficiently stained. Just off camera here there is a little sink running at a very, very low kind of pressure. So I just use that in between the 2 stains to just make sure any excess is removed. I don't want an overstained slide, so the water in just off the side of the camera, sorry, there we are, is used just to remove any excess staining. From here I rock it back and forth on the puppy pad just to remove any excess water, and then I take it over to our little microscope area in the corner where we have a hairdryer, and from here I can blow dry that slide until everything's nice and dry on it, and then the vets can have a look at it under the microscope. Here I am just setting up our slide on the microscope, my ID badge, sorry, because I can't figure out how to uncrop this video. So it's a little bit zoomed in, I apologise. We have our white cell counter down the bottom. I've popped my slide just on the stage and I'm starting off from the shortest lens, or the least magnified, just so I'm not doing any damage to any of the lenses or to the slide, or to the stage either. From here I can turn on the power switch around the other side of the microscope, just down on the right, and that is what powers our light. I can then turn up the light so I can view my sample. Move the cleaning wipes out of the way, I apologize. And from here, on the least magnified view, I can find a good field that is going to give me the most accurate kind of diagnostic view for me to then adjust the lenses and go up in magnification. I am just adjusting the fine focus knob on the other side, and moving the slide into the most appropriate field to be able to see any abnormalities, but any white blood cells that I'm looking for. So from here, I can see the white blood cells that I'm looking for, 4 in kind of the upper right quadrant, and then 3 on the bottom, on the left-hand side of the sample. So from here, I can take my slide off, adjust to the least magnifying lens, give all the lenses a bit of a wipe over with a Kimtech wipe, something that's not going to damage them, and then clean the stage with my Kimtech wipe as well. Then I grab alcohol wipes just to wipe over the whole body of the machine, so starting with the eyepieces, the top, going around the sides and the back, just to disinfect everywhere that possibly could have been touched. From here I can also place the dust cover back over the microscope, just to prevent any damage occurring or any dust settling on the sensitive parts. This is part 3 of task 1, performing a PCV, a packed cell volume, and a total plasma protein blood test. So I have my heparinized tubes, my wax plate to seal them, a very clotted EDTA sample, but this is just a demonstration for the assessment. I wouldn't be relying on a clotted sample to be able to give us accurate results on things, but we start off with PPE, especially if we think that the blood sample has come from a patient that may have something zoonotic. We start off just by 3/4 filling the tubes, just with the capillary action from the end of the sample. It's a nice mess-free way to do it. From here I kind of plug the end of the heparinized tubes with wax, and I make sure I do 2 just to balance the centrifuge and to compare results at the end as well. I just want to make sure both samples are giving me an accurate reading. Once I've got 2 samples that have been plugged, I can pop them into the centrifuge just on opposite positions in order to balance the machine. I don't want anything to crack in there and to have to either damage the machine or restart the results, restart the whole diagnostic test. So I secure the centrifuge with the top plate, close the lid, and select the blood settings on the machine. Any settings for various tests we run are included on the top of the centrifuge, but once they come out of the centrifuge, the plasma and the red blood cells will be separated, so I can put it onto a handy dandy little reader we have here. I just want to make sure that the top of the wax line is in place with the bottom of the test. And then the top level of the serum is at the top level of the reader, so that I can determine that the PCV here is about 65%. These results get added to our in-house patient record sheet for PCV-TP results. just in case we can't add them immediately to the patient's EasyVet file or VetRadar treatment chart. So once I've obtained the PCV result, I can move on to obtaining the TP result. So we want to use just the plasma sample. In our clinic policy here is to use the end of a catheter to push the wax strip down on the centrifuge sample, on the centrifuge tube, just so that we get the plasma sticking out the end. Some clinics will also break them, just depending on hospital policies and procedures. We want to make sure that the sample covers the whole slide of the refractometer, and then close the lid and view it under a light source, and that will give us our TP. To clean the refractometer, we just use demineralized water, give that a wipe on both sides, and then place back on a puppy pad to dry, and then we can record the TP result. From here, we are running a in-house urine analysis on a free catch collected sample. I've got it in a yellow top sterile tube, and also a patient label to go with it. I have the sample in a kidney dish to be transported into a yellow top tube. I use a syringe just to avoid pouring it and potential spillage. That goes straight into the container, the sterile container. And I repeat this until a sufficient sample is added into there. From here, we can use our patient label on top of the sterile yellow tube, just paying attention not to cover all sides of it. We want a visible window of the sample in there. We take out what we need from it to do a in-house urine analysis. So I'm going to be doing a dipstick and a USG on the refractometer as well. I start with appropriate PPE because this animal, we don't have any concerns for any zoonosis. It's not showing any symptoms that could be indicative of any zoonotic disease, but I just don't want to have urine spilled on me, so making sure I've got gloves on. We do have two types of dipsticks, one for manual and one to go into the IDEXX machine, so I want to be using a dipstick that is going to be compatible with the machine. As displayed up the top there, has our little sample windows on there. Make sure the test tubes are closed. Obtain our sample. I use just a 3ml syringe to put a little dot of urine, a little tiny drop of urine on each window. But a pipette can also be used. So from there I only need about 1 ml of sample. I apply just a drop onto each window, timing when I've started, just so I can make sure to read the windows at the appropriate time. Some are about 30 seconds, some are about 60 seconds, some are about 90 seconds. So making sure each little test or window has a sufficient sample on there, disposing of the rest back into the sample and the syringe into the bin. And then closing up our sample, that will be put in the fridge. From here, I can add on our test strip into the machine, press the operate button. That will print out a little receipt slip that I can use to write down further findings on there. So things like USG, cloudiness, colour, things like that, things that the machine isn't able to tell us. So once the machine prints out that little label, there we are. I can fill in the collection method, which is free catch. The colour, this one is oddly fluorescent, but if it was a real urine sample, we would be aiming for nice pale straw yellow. I can check the clarity of the urine by attempting to read either the patient label through it or the dipstick container, or we do have a poster up on the cupboard door that's appropriate, just to ensure that we can read text through the sample, it's not too cloudy, and then I can go ahead with doing a USG. So very similar to reading a TP result, I pipette a small amount of sample onto the slide and look at that under a light source, and I can record this USG as 1010 or 1.000, and that's our UA done. I add the patient name up the top, and then all those results can be entered into EasyVet. So this is our appointment booking software, patient chart software, also contains all our owner details. So here I am finding the patient, going into their most recent consult and the diagnostics, adding that their PCV TP result. We're lucky that we have designated templates laid out for many of our kind of in-house diagnostics that we do. So adding in a normal PCV and a normal TP, hitting add, and then that's saved to the patient file. I'd also put in the in-house urine analysis results as well. So yeah, once we click tab down from the input section, the next editable section is highlighted for us. It's a nice, smooth process. So once we've finished adding all the values in, we would hit add, and that can be saved onto the patient file as well with the PCV TP results. There we go.